Hello friends, we are going to discuss about different important points for NEET PG. So, first, interleukins. Interleukins. First, caspase 1 activates interleukin 1, 1. There is another term, anahindra. Number one, first letter, it also activates interleukin 1. Next, interleukin 2, that is 2. 2. It causes T cell activation and proliferation. T cell activation and proliferation. Interleukin 4, D, fourth letter. So, differentiation of immunoglobulin. Differentiation of immunoglobulin. Next, interleukin 5, E, fifth letter. So, it causes activation of eosinophil. Eosinophil. Next, interleukin 6. Interleukin 6. 6 resembles like small b. So, B cell stimulation. B cell stimulations. 6 resembles like small b. So, B cell stimulation. Anti-inflammatory property has interleukin 10, lipoxin, tumor growth factor beta. Next, interferon gamma. It is gamma. So, granuloma formation. Granuloma formation. Next. Next is tumor growth factor beta. Beta. So, it cause fibrosis. It's cause fibrosis. Beta, beta. Next, there are some drugs called dacilizumab, dacilizumab, and basiliximab, basiliximab. So, B, second letter, D in Hindi, do means two. Both acts against means antagonist of interleukin 2, and interleukin acts in T cell activation and proliferation. Interleukin acts T cell activation and proliferation. So, if it antagonist of interleukin 2, it cause immunosuppression. It cause immunosuppression using renal transplantation. Use in renal transplantation. Next, next is omalizumab. Next is omalizumab. Omalizumab. Omalizumab acts against mast cell. Ma ma. So omalizumab used in severe asthma. Using severe asthma. Next, mepolizumab. Next, mepolizumab. It is interleukin 5 antagonist. Interleukin 5 antagonist. 5 antagonist. So, interleukin 5 stand for eosinophils. So, it is used in eosinophilic asthma. Severe eosinophilic asthma. So, mepolizumab used in severe eosinophilic asthma. Next, there are few points regarding stains or staining. First, mucicarmine stain. Mucicarmine stain. Mucin. So it stands for mucin. Next, Congo red. Congo red stain. C. Amyloid. A. C. 3. Fontana Mason silver stain. Fontana Mason silver stain. M for melanin. M for melanin. M for melanin. 4. 4 is Prussian blue. 4 is Prussian blue. Stand for iron, like F E P, looks like F. So Prussian blue is for Fe, cause iron. Next is von Cossa stain. Von Cossa stain. Von Cossa stain for calcium. It should be remembered, von Cossa stain for calcium. Next is TRAP, tartarate resistant acid phosphatase. TRAP, tartarate, tartrate tartrate resistant acid phosphatase in hairy cell leukemia. Next, toluidine blue for mast cells, and basophils. How you can remember it? In Hindi, mast नील आकाश, mast नील आकाश. Mast goes for mast cell, Nil goes for blue, and B for basophil. So mast nil akas. Last but not the least, fuel gene stain. Fuel gene stain for DNA. How you can remember it? DNA cause generation mutation, generation maintenance. Generation maintenance. So to maintain the generation, we need fuel. So to maintain the generation, we need fuel. DNA fuel. Next, there is a various type of giant cell. Various type of giant cell. Giant cells. Various types of giant cells. First, Langhans giant cell. Langhans giant cell. Seen in TB horse shoe. Langhans giant cell in TB horseshoe shape. Next, Teuton giant cell seen in xanthoma and fat necrosis. And fat necrosis. Next, Warthin Finkelter giant cell. Warthin Finkelter giant cell WM. WM. So in measles. Here you should remember point that is Langerhans cell. Langerhans cell. Langerhans cell. It is not a giant cell, it is a antigen presenting cell. Antigen presenting cell. It is antigen presenting cell. Next, important gene translocation. Important gene translocation. Gene translocation. First is T814. 8 looks like B, so Burkitt lymphoma. Next, 1122 Q24 Q12. It is 11, so Ewing sarcoma. Ewing's sarcoma. E for Ewing sarcoma. And you also can remember 11 to 22, 12, 24. In this way, you can remember Ewing sarcoma. Next is 922 Q 34q11. So 1122, it is seen in CML, Philadelphia chromosome. BCR-ABL gene, it is Philadelphia. Next point. Next point is next point is 1114 for mantle cell leukemia. Mantle cell leukemia. How you can remember it? M. If we erase these two arms, it looks like 11. So mantle cell leukemia. 5, 18, 14. It is follicular lymphoma. Follicular lymphoma. How you can remember it? Fuck at 18 years. Fuck at 18 years. Next. Next, some important points regarding drug induced. Regarding drug induced. Drug induced. It's a very important point. First of all, in case of drug induced, we can see lupus nephritis. Lupus nephritis. So in lupus nephritis, no kidney, no CNS involvement. No kidney, no CNS involvement. Next, drug induced pimple or acne. It is monomorphic in nature. Monomorphic in nature. Monomorphic in nature. Next, drug induced pemphigus vulgaris. Drug induced pemphigus vulgaris. Drug induced pemphigus vulgaris. Here, no auto antibody production. Auto antibody production absent. Auto antibody production absent. And that's all.